Hi, everyone, and welcome back to Stretched Unscripted. I am your host for today, Zora Szabó, and I am here with Dr. Mark Callery.
Thank you. It's good to be here.
So before we get started with our conversation, I just want to thank our sponsors, Blue Cross Blue Shield of Oklahoma, Telegen Community Initiative, as well as Catalyst Co-working, who is letting us use this podcasting space for free. So to get started in our conversation, I just wanted to let you guys know that I met Dr. Mark Callery through a summer internship this past summer, actually. So I just wanted to address him and say that was an amazing opportunity, and I want to thank him for letting me do that, but also just ask why you got into starting these summer internship programs for students.
Sure. No, that's a great question. And it was very much a pleasure to meet you as well, and appreciate all your hard work. The summer internship program was really born out of recognizing that there was a need for college students in particular to get clinical experience. And I am a third generation doctor, and I had a son at that time that was very interested in going to medical school, and he was having a lot of trouble finding shadowing hours, to be honest, and so we began to see that there was a need. And so we said, okay, well, can we put together a program within Utica Park Clinic that helps meet that need? Because what I learned is that medical school is really competitive.
Oh, yeah.
Getting into there is really competitive. I think it's a lot harder now than it was when I applied, for sure. And so I just went to our kind of leadership and said, this is what we need. I think this is a great long-term opportunity to invest in pre-med students. And so we did it. We said, okay, we'll start a program where we offer them, time in clinics. We do a little training at the beginning on making sure you know how to take vital signs and, room a patient and all those random things, and then put you in a clinic for the rest of the summer and pay you along the way, which is really nice as well. And so it was, that was an opportunity to do that. And we did it the first summer just kind of as a pilot project, and it worked out well with the one student we did. And so this last summer we expanded to 5, as you know, and we decided to go ahead and bring in like some guest speakers from the medical schools and different things. And it turned out to be a really great program, at least in my opinion. I'd love to know your feedback on it for sure.
No, I absolutely loved it, especially with me since I'm applying to medical school, and also the same exact kind of background of I could not find shadowing hours that aligned with like my work schedule, with school, and like just during school year. So it was like perfect that it aligned with my summer because I wasn't really doing much at the time, thankfully. But it kind of showed me that originally when I was thinking about family medicine, that's kind of the route I wanted to go. For those that are into it, I'm glad. Not for me anymore, but I'm thankful for it, like having that experience to see it. But I did have the opportunity to actually shadow in an orthopedic clinic, and I realized I really enjoy it.
Sure.
So it showed me like just knowing that I have a sports medicine background with my undergraduate degree being in exercise sports science, it just aligned more with like my interests, as well as me being like, I used to be an athlete. So just seeing like behind the scenes of how orthopedic doctors kind of interact with patients and see like the daily routine, it was just a really amazing opportunity. So definitely going that route, hopefully once I get into med school.
Yeah, no, that's a really good point actually, because we identified 5 clinics where we wanted to put people and try to get some variety between specialty and primary care. But one of the goals is to help you all, or help the people in the program, to get exposure to lots of specialties, because a lot of times you get into medical school and you think, oh, I want to be family medicine. I've always thought I want to be the small town doctor or whatever it is. And then you start getting exposed to these things and you're like, oh, wait, that's maybe not exactly what I thought it was. Still a great profession, but maybe I want to be orthopedics or whatever. And the earlier you get exposed to some variety, the better it is and easier to make decisions, because sometimes that can affect the rotations you take in your 3rd and 4th years even. And so if you already have a better idea of what those different specialties look like, you can make more intelligent decisions later on, for sure.
Most definitely. So in continuation with that, do you have any like advice for students into like getting into these like extracurricular programs and internships? Because I know a lot of them aren't aware of like how to find these opportunities.
Yeah, well, I wish I had a lot of great advice, honestly, because part of what I did was go out and start researching who offers things like this. And I didn't find a lot, right? I mean, and so that's why we created it. And so I will say this, last year we were kind of late in the game with your group, you know, and I don't even think we told you until maybe May or something like that. And you're like, okay, it's less than a month and you're starting.
Yeah.
We also have learned from this process. And so we're going to be opening up applications into February, early March this year with the hopes of people knowing by April, you know, whether that's the position for them this summer. That way you can make decisions for what your summer program is going to be and all that. And so I would just say start looking earlier. We're going to help try to meet that need from our perspective earlier.
Yeah.
But, you know, don't wait until it's May and try to find something from June, because especially a big health system like ours, or a lot of health systems, you just can't apply and expect to start immediately, you know, and so you got to give yourself time, but you also got to give us time to do the hiring process. And you remember kind of probably what that was like.
Yeah.
And so just don't wait too long, probably.
And so with that internship, where can like participants particularly like find that application? Is it going to be through like Utica Park Clinic or Hillcrest or? Yeah,
so the easiest place will be on our website. So if you go to any, still, first of all, of course, not everybody probably knows. Hillcrest Health System is the big name for our group, and within that you have, you know, derivatives like Oklahoma Heart Institute and Utica Park Clinic, and then the Hillcrest hospitals and all that. So, if you go to any of those websites, you can see jobs for all of those locations. And so, if you go to any kind of Hillcrest website and look at the job listings, it'll be listed on there.
Okay, perfect.
Yep.
So, again, you mentioned that you were third generation family medicine doctor. Do you want to elaborate on like what your day-to-day role is as a family medicine doctor, like how you got into that profession? Yeah,
you know, so I did go into medical school thinking I'm going to be primary care of some sort. Pretty sure I was going to be family medicine because that's what I'd always seen. My grandfather was in Locust Grove, so just down the road an hour. He actually moved there the day Pearl Harbor was bombed, which is kind of interesting. I'll never forget that, right? Of course, I wasn't alive, but I remember the date. So he worked there for 50 years. And then my dad settled down in kind of Poto, saw that area. And so I saw that side of things and saw what his lifestyle was like. And so I knew it was something that I wanted to do. I had, fortunately, a lot of experience to know that. And so it was never really a question for me. I kind of always thought, at some point I thought maybe I wanted to be an OBGYN, interestingly enough, but the lifestyle is kind of crazy. So family medicine is a lot more tame than that. So that's kind of how I ended up there. And did I answer your question? Because I feel like I went all over the place, but I'm not sure I actually did.
More of like, again, like your daily routine of what you do. And just like, again, you were third generation, you've been exposed to it. That's probably why you went into it. But again, like on that route of what, if anyone's considering that family medicine practitioner.
Family medicine, like all specialties, has evolved some over the years. I mean, even for me, I've been in practice since 2006, so almost 20 years now. When I first started in practice, family medicine, you know, I saw patients during the day, and then I may have to go to the hospital and make rounds in the morning or in the evening or on the weekends and things like that. That's kind of your classic family medicine. And in small town, that's a lot of what you still get. And you see just a little bit of everything. You're not, you know, referring a lot of people out. You're just taking care of it. But now, especially the more in the urban areas, I don't do any hospital medicine. You know, I basically, when in my family medicine role, you know, it's an 8 to 5 Monday through Friday with some, you know, I'm always on call for patients overnight, but I rarely get a call, you know. So that's part of it. Now, the other interesting thing is I'm family medicine board certified, but I don't see patients all the time. So just kind of a unique take on what you can do with family medicine. My secondary role is what they call a medical director for population health. So half of what I do is all administrative work. So I'm in the clinic 4 half days a week, and the rest of the time I'm not, and get to do things like this clinical intern program and do that. And a lot of people don't know what population health is, but I get to look at, you know, we have, you know, 35 plus clinics across Utica Park Clinic, 140, I think, last I counted, primary care providers. So I look at like the big picture. We have 50,000 people that are on Medicare, for example, in Utica Park Clinic. And I look and see how are we doing controlling blood pressure across all of our patients?
Oh, wow.
Or diabetes across all of our patients? Or how effective are we at breast cancer screening or colon cancer screening? And can we get better for everybody? You know, not just what am I doing there in the exam room for my patient, but how do I make sure every patient that comes into Utica Park Clinic gets the best quality care they can. So that's one of the things I'm really passionate about in family medicine. And I feel like I get to impact literally thousands and thousands of lives as opposed to maybe a panel of 1,500.
Yeah.
So that's one thing about family medicine and internal medicine. A lot of those kind of broader primary care, you get that opportunity to move up into some leadership roles, which has been pretty fascinating too.
Oh, that's amazing. So have you had any influential people that have kind of helped form or shape who you are as a person today?
Sure. Yeah. So, I mean, the obvious choice would be my dad, and I know that's kind of a cliche, but it's very true, right? I mean, I saw him take care of people my whole life. I mean, I can honestly tell you, I can picture in my head, one time we were on a baseball trip. I was younger. It was my older brother's baseball trip. We were in a hotel room, and one of the kids, out on traveling, and one of the kids had slipped by the pool and busted their head open. And he literally sewed up somebody's forehead on the bathroom sink in the hotel room. Okay?
Wow.
So, and I was just standing there watching like, this is the coolest thing ever, And I was like, that would be really fun to be able to do someday. I'm not necessarily recommending that, but that's just kind of the things that you can do. And I saw him do that, right? And I saw him offer compassionate care to people. And he's truly one of the kindest people you would ever meet if you ever met him. And so I saw how that affected him and how that, just brought respect and to the people he knew. And we were living in Poto or in Salsa and small towns, and everybody knew him. Oh, you're Dr. Callery's son or whatever, and it was a good thing that you were Dr. Callery's, not like, oh my gosh, and so I would say that, I mean, that from a just truly clinical and kind of big picture mentor, definitely him. On the other side, administrative, our chief medical officer, his name is Jeff Gallus. He really has been the one that's mentored me a lot in kind of on the administrative side of things on population health and shown me that there is this kind of different path where you can be a leader and not just a doctor, but lead other doctors. And so those are probably the two I would say first.
Oh, wow. That story of your dad with that incident is definitely still in my brain, because that's definitely something if I would have seen it as a child, I would have been traumatized.
Yeah, right.
I'm glad it motivated you to go into your profession. So you're currently a doctor of osteopathic medicine.
Correct.
So for students that don't know the difference between what a DO and an MD doctor is, how would you kind of break that down for them?
It's funny. That's one of those things that I've been asked so many times in my life, and sometimes I feel like I have a good explanation and sometimes I don't. And honestly, partly it's because everything's evolved so much over time. I mean, historically, the MD side of things was the traditional doctor that everybody knows about. Back in the 1800s is when the DO world became a thing, and you had this guy named A.T. Still that said, okay, well, this is what regular medicine is, and it was all this kind of weird stuff, right? I mean, they were drilling holes in people's brains and, giving them poison and all these kind of things. And he's like, that can't be right, And he really started to look at not just, what kind of medicine can I give this person or whatever, but how does the whole body really work? And how does it all work together? How does your mental health affect your physical health? How does your spiritual health affect your mental and your physical health? And how does just everything that's going on around you affect your body's ability to be healthy? Even like social determinants of health. I don't know if you guys talk much about that. I mean, that's a big thing in medicine these days. How does an adequate diet affect your ability to be healthy? How does transportation affect your ability to be healthy? I mean, if you can't get to the doctor, you can't do it. If you can't go to the pharmacy, you can't be healthy. And he was looking at this stuff, 150 years ago and talking about how all this plays together. But then also, how is the structure of the human body, how does it affect how well it works? So if your back's out of line, does that affect how well your lymphatic tissues, work, and all these kind of things? And so it's kind of this more whole person approach traditionally. And that was probably one of the biggest things we've always emphasized, that it's not just about treating the sickness, it's about treating the whole person. And I think, fortunately, what we see now is that the MD side of things is recognizing that that's really the way to go. And you're seeing that more and more and more, where they're saying, okay, you need to address these social drivers of health. You need to address the behavioral health and all these kind of things, because it really does truly all make a difference. So in the end, it's just a degree, right? It's either DO or an MD. And most of the time, you're not going to notice a difference between one and the other in the exam room. In fact, even a lot of people don't realize there's two different forms of dentists, and you would never even look to see which one's which. You just go to the dentist, right?
Yeah.
That's kind of how it is now. It's like you go to the doctor or you don't go to the doctor.
Honestly, yeah.
And so I will say this. I've had a great experience in my life. I've never been held back because I was an MD or a DO or any kind of thing like that. And I will say, I feel like, at least my understanding and talking to some MD cohorts, that even the medical school process, the DOs really focus on you as a person and not just here's a student that we need to graduate. But, I feel like they do a good job of creating family. Like I look back at my classmates and it was never this kind of cutthroat, like, okay, well, this person's top 10 in the class and this person's bottom 10 in the class. And if I can squash them, then I look better. It was everybody helping everybody. And I think that's part of the character of osteopathic medicine that comes out in education.
That's amazing. So for students that are wanting to apply to medical school, what are some like tips or tricks that you want to like kind of share or highlight for them?
Yeah, so I wish I was closer to applying myself to be super accurate on that. But I will say, having had a son who recently applied and actually a daughter-in-law now who's applying, I have learned some things in the last few years that I think have helped. And, I think it's one of those things you just have to go off that ledge and do it. When I went to medical school, nobody took a gap year. It was, you went to college, you went to medical school, there was no break, you just kept going, right? And that's different now. A lot of people are taking that extra year or they're getting a master's degree and things like that, which is great. I think those are all good because I think those do help you be more competitive. But I also, encourage people, don't be scared to just go straight ahead, right? I mean, it's a long process and it's a lifetime decision. So yeah, sometimes you get down to that last year of undergraduate and you're like, man, I need a break. And I get that, but I would say don't let that stop you from going ahead and apply, because if you do get in, this may be the year that you get in a lot easier than the next year, right? So just go ahead and apply. There's some cost to it. But go ahead and apply. Who knows? Maybe you'll go ahead and get in the first time, and maybe you don't, and you're going to apply the next year and end up with a gap year that you didn't necessarily know you were going to have. But my recommendation is don't wait, so.
Well, that's actually really good advice. So for students that are still like in high school for like, let's say 9th through 12th grade, who are potentially wanting to pursue some sort of healthcare related degree, whether that's in undergrad or whenever they want to do it, what is some advice that you would give to them to like start thinking about potentially going into a healthcare field?
So I will say this, I don't think there's a lot of, I think one of the things you have to consider is where you're going to go to college, right? And I had this conversation with my kids, and to me, the undergraduate degree, if you know you're going to do medicine, really means very little. I mean, you might get a little better preparation at one place than another, but having undergraduate degree from Harvard and hundreds of thousands of dollars in debt, or having an undergraduate degree from Rogers State, where you only have a little bit of debt, you're going to be glad that you probably, honestly, a pretty similar education. And your end goal is just to go to medical school, because that's the only degree that really matters at that point. Nobody ever asked me where I went to undergraduate school. I did go to OSU, by the way.
Fair point.
But don't let that be like, oh, if I can't get into this Ivy League school or this SEC school or this whatever, stop you from thinking, okay, I'm never going to make it to the next step.
That's actually really good feedback, because whenever I was applying to college, I was trying to apply to all those big schools. I wasn't even thinking of University of Tulsa at all. Don't know how I ended up here, but I'm glad I did. That we meet you and all these other people. But is there any last minute advice that you might want to give to anybody watching that you haven't mentioned so far that might motivate them or inspire them further? Yeah,
well, I would say along the same lines of choosing a college, choosing medical school is similar. I mean, you're definitely going to find some that are better than others. But in the end, again, it comes down to, do I want to be a doctor or not? So you don't have to go to Harvard to be, the chief of thoracic surgery at, the Mayo Clinic. I have friends that graduated with me from OSU Com that were at the Mayo Clinic and all over the world, right? And so it's not about, again, that degree isn't always the biggest thing. Now, there are some either where they're going to be like, oh, you didn't graduate from Harvard, then I'm sorry, but that's so rare. Just go where you have a family and support, and you have people around you that can help you. That's more important than the name on a degree.
Well, that's perfect. Well, I'd like to thank you for your time today. Sure. And then lastly, just as a reminder, thank you so much for watching. And you can find this podcast, Stretched Unscripted, on Spotify. We are also on YouTube. So make sure you like, comment, and subscribe on who you might want to see next as a profession. And then stay tuned for the next episode. But as of now, bye, guys.
Thank you.